Hi, my name is Anisur, Rahman, and it's always a pleasure to do anything for Lupus Europe. They've asked me to just summarize a talk I've just given, which was in a session about treat to target. So treat to target is a way of improving the management of patients with chronic diseases like lupus. And what it means is that you set a target. Every time you see the patient, you see if they're meeting that target. And if they're not meeting it, you change their treatment until they do meet it. It's been proved in blood pressure and rheumatoid arthritis. It is challenging in these because defining the target in lupus is not as easy as just measuring the blood pressure. We have to measure how active the patient is. We have to measure whether they're flaring or not. And we have to use very little steroids, or as little as possible. That's what treat to target means. Now, people have made progress in getting to treat to target. But what I found and what I talked about is it depends very much on where you live, because there are lots of costs associated with treat to target in the way that it has now been defined. Costs of seeing a doctor, of having blood tests, getting the drugs. In many parts of the world, maybe even in Europe itself, this is beyond the reach of many patients. It's too expensive. So the question is, what should we do about that? Should we only define treat to target in a way that can be achieved in wealthy countries? Or should we try and be more inclusive about the whole world? I don't know the answer, but I and some others are trying to arrange a commission to look into this. And I hope at some future European lupus meeting, I'll be able to tell you what we've done.